The topic of the day is the coronavirus strain. Should we be worried? There's a new strain. It's found in the UK, or it started in the UK. There are several names for it. One of the names is B117. It was first seen in September 20th in Kent, a county southeast of London. It did appear to be more contagious, and then there was argument, was that true, is it not? The most recent information indicates that it's true, but it's not proven conclusively yet. It's similar to another strain which has been found in South Africa, 501v2, and we'll talk about how they name these things in a minute. This picture of the virus looks a little bit more accurate. While it does appear to be more transmissible, maybe not more deadly or more virulent. It has 23 mutations. That's a relatively high number. But we're going to talk about this. People think, oh, there's a new mutation. Oh my gosh, run for the hills. Well, there have been 90-something thousand variants tracked or taken, 92,000 samples taken to look for the genetic code in COVID virus alone. 12,000 of them had mutations. So viruses mutate all the time. While individual types of mutations have already been seen in plenty of other strains, this combination of 23 mutations have made it a little bit more likely to spread. Scientists found changes in the spike protein. That's what allows the coronavirus to enter cells. Out of the 23 mutations, they're looking at a specific one called N501Y. That N501Y is the one to remember if you're that geeky. It talks about the amino acid asparagine replacing tyrosine, asparagine being N, tyrosine being Y, in the 501st position of that viral protein sequence. N501Y is the part of the spike that actually comes into direct contact with human cells. So it certainly makes sense. The same mutation found in the South African variant also appears to be spreading. Reasons to be worried or not? Here's the reasons to be worried. In the areas of the UK variant is spreading, it's accounting for a larger proportion of new cases. Early data shows that patients with the UK variant do have higher viral loads, and this may indicate that it's having an easier time replicating. Outside of the founder effect, and we'll talk about that a little bit later, if a strain unseats a previous founder strain, it is likely more infectious, more contagious, more transmissible. The increase in cases didn't co-occur with any overly obvious change in human behavior. Again, it could be coincidence. Maybe it's emerged at a time of year when there was increased family and social mixing. Thanksgiving, Christmas holiday period in the UK. Now here's some reasons not to be worried. The mutation is not new, it's not unusual, or the fact that the virus is mutating is not new or unusual. The process of making viral copies is prone to error. I'm going to talk a little bit later in one of the slides. There's a great video out from a fellow who's a virologist. We almost had a virologist on with us today, David Vigorous. We hope to get him on to talk about some of these concepts in the future. His point was viruses mutate all the time. And if you just understand how viruses replicate in the host cell, in this case in the human cell, you begin to get an understanding of why that happens. They come in, they infect, they have to take over the DNA and RNA replication series. They have to shut down DNA replication because this is an RNA virus. And they have to take over the components of RNA replication. This may help you with a link, connect the dots that our current virus is using a new technology called messenger RNA technology. So we're coming in with the vaccine similar to the way the virus does. But instead of creating new virulent disease-causing viruses, all the vaccine is creating is that spike protein. So now, once somebody has that vaccine, their immune system will have recognized that spike protein because the vaccine made them do it. And then when they're infected, when they get exposure to that spike protein again, when it's attached to the virus, they're going to reject it. The immune system will already have been down that path, seen that rodeo, and pushed that virus out. Most of the time, mutations in viruses mean nothing. Some mutations may even harm the virus. Sometimes mutations can give a virus an advantage, like the ability to infect more cells. I will also say this, go off script for a second. Quite often, when an epidemic happens, a new virus is introduced to the human population. We saw it with bird flu, we saw it with different types of flu. As they begin to spread through the human population, a couple of things happen. They do tend to become more infectious, but most of all, they tend to become less virulent. And guess what? One of the most common ways for a virus to become more infectious is to become less virulent. And when you think about the basics of host parasite concepts, if I'm a virus and I need my host to spread me to others, he's not going to do it as well if he's dead or if he's isolated in a hospital bed because he's very sick. We want to not make our host sick. SARS-CoV-2 has already been mutating through the course of the pandemic. As I mentioned, there are 90,000 that have been tested. 12,000 are different variations. In May, we discussed a coronavirus strain that was identified at the Los Alamos National Laboratory. You may remember that. If you do, I'm impressed. That virus that strain did unseat the founder strain that was in New York at that time. There was a different virus that started in New York. This new strain came in and replaced it within a matter of weeks. Back then, researchers had identified 14 mutations. One of those mutations, D614G, affected that spike on the outside of the virus. I mentioned founder effect a few minutes ago. Here's the thing. If a few organisms get separated from their parent population and they don't carry the same set of genes, the resulting founder effect will cause a separated population to become genetically distinct from the original population. In other words, in a pandemic, you have different arms of genetic variations going throughout the susceptible population. As we mentioned, there's a lot of genetic variations, a lot of mutations. So what you get is different strains going through the population. Some are more infectious than others. That may be true, but don't assume that just because you see something in a certain variant in a population, don't assume that that's the strongest variant. And don't get scared. That's one of the major messages of this video. These strains tend to scare us anytime you hear about a new variation. We're going to hear a lot. Probably still not the last time we're going to hear about new variations. When a strain is introduced to a population, that strain is then the founder. Now, when a new strain comes into that population, it's going to take a significantly increased transmissibility for it to supplant that founder, that earlier strain. So the estimate that the UK variant is 70% more contagious is based on modeling, not lab experiments, and we're getting more and more information. I think it's going to be a few weeks before we know for sure just how much more infectious it is. The UK does a lot of viral sequencing. It picks up on the new strain quickly, and that probably overblew the case a little bit. So, if you're going to see new strains, one of the places that's most likely to pick them up is the UK, simply because they are doing so much testing. The US has only sequenced 51,000 of over the 17 million cases reported in the country. Out of the 275,000 full-blown genome sequences in the public databases, 51,000 of those are from the US and 125,000 are from the UK. So reasons not to be worried. The UK variant may have already been spread in many countries and not being detected. Just over the past 24 to 48 hours, you're starting to see records and detections. I think there was one recently in a man in Denver. The variant could already be in the United States without having been detected. That's a quote from the CDC on December 22nd. The UK variant may have arrived in the US in mid-November. Many people in the US could already have been infected. Scientists scoured genetic sequences of the coronavirus in the US to see if there was any matchup. So far, there wasn't. Again, this was as of 48 hours ago. I think that has changed at this point. Viruses often downgrade in virulence as they increase in infectiousness. That's what I said a few minutes ago. One of the best ways to become more infectious is to decrease your impact on the lifestyle of your host. How this happens is simple. It's easier to transmit a virus if you have fewer symptoms, if you aren't in the hospital, if you haven't died, etc. So would mutations affect the performance of vaccines? Short answer, spoiler alert, probably not. It's possible that the coronavirus could someday mutate to make current vaccines ineffective. If and when that happens, I have every expectation that we will modify the vaccine at that point to make it effective for the new variant. Still, many experts say it would take years, not months, for the virus to mutate to a point where people's antibodies or current vaccines become ineffective. Again, we're talking about small changes in amino acid sequences, and out of 30,000 base pairs in the COVID vaccine, you would think you're going to need more than just a dozen changes in that sequence to result in something that's going to totally negate the impact of the vaccine. The design of most COVID vaccines is based on epitopes of the virus's spike protein. The chances that a mutation would alter all of those epitopes is low. Scientists at the University of Texas Medical Branch have reported preliminary evidence that antibodies to neutralize the more common coronavirus strain also neutralize the strain with the N501Y mutation. The new COVID vaccines are equipped to adapt. For example, the Pfizer, BioNTech, and Moderna or mode RNA vaccines both use mRNA. One huge advantage of this approach is that mRNA sequence can be altered very, very quickly. Will there be more mutations? Probably. The UK and South African variants are unlikely to be the last. It's constantly evolving like any virus in a pandemic. We should expect it to keep changing. Will new strains be more infectious? Like I said, that's the tendency that you see with most programs. The first mechanism for viruses in a new pandemic to become less virulent is that it's an epidemiological error. It's where a virus comes out, you don't know it's there. The vast majority of patients and doctors don't know to look for it. Bad things happen to people, they look for other reasons. Once they become aware of it, then we find that there are a lot of people infected that we just never knew about. So the denominator changes. That is the major reason for the first few weeks, maybe even the first few months of a virus appearing to get less lethal, less virulent. But then the biology itself tends to make it, again, more infectious, but less virulent for the reasons that we talked about. So here's the bottom line. What should we do? It's a good thing that we already know how to respond to these new variants, the same way we're responding to the pandemic, as the virus still transmits primarily through air. Mask wearing, social distancing, and good indoor ventilation are as crucial as ever. Now, I know once you start talking about that, you start getting into political issues. I'm going to leave that part alone for now and just cover one other point. There was a great video by a fellow named Vincent Racaniello. Here are a few quotes from Dr. Racaniello. It's very hard to tell using epidemiology whether a virus is more infectious due to the founder effect. He did go in and give us some definitions, which I think are helpful. Mutations versus variant versus strain. A mutation is simply a genetic change, nothing more. And it happens about every other generation of the virus. A variant is a genetic change that actually results in a different protein, and a strain is a variant that actually makes a difference. So you've got multiple mutations. Only some of those result in a variant, and you really get multiple variants before you ever get a strain, and a strain means it is significantly different. Again, more or less virulent and more or less infectious. Another quote, again, viruses mutate all the time. And this is the statistic that I mentioned a couple of times. 12,000 over the 90,000 that he had available at the time were variants. And when you think about how they replicate, it becomes clear why it's so common to see a virus mutate. Here's maybe the most important of this topic. Let's move on from the scary headlines. We know what we've got. We know what we need to do. Let's just do it. So I'd like to talk with you a minute about the webinar. People don't understand what the webinar is. It's actually a great way to get some access to healthcare that you're just not going to get any other way. You actually get the lab tests yourself at a local lab, a Quest lab near you, for the inflammation panel and the OGTT and the insulin survey. These are things, inflammation and prediabetes, that your doctor just does not know about. And here's the thing. Harvard Health and many others have said, look, sudden death is not always so sudden. The Hollywood picture that it's a bolt out of the blue is Not realistic. It's more like real lightning, preceded by clouds, wind, and rain. Stop that metabolic storm before the lightning strikes. And here's where that metabolic storm comes from. It's inflammation, and it has to do usually with prediabetes. So again, we actually get labs, we go over them in the webinar, and then you can start finding out how you can prevent that heart attack others said that you couldn't even predict. We can show you how. Thanks.